For joining our second APP webinar. Just a reminder, I'm Sarah Reed, PA from Duke, and it is truly a privilege for me to introduce my friend and colleague, Meg Leddy. Meg graduated from the Yale program in 2005, and she has experience ranging from orthopedics to CT surgery, surgical oncology, where fortunately our paths have crossed. And she's really been a stellar PA in and out of the OR, PA, wife, mother, friend, and she's going to kindly share some of her experience with burnout and more importantly, wellness, how she has transitioned from burnout to wellness. So I recently heard Meg speak at a PA summit, and I'm really excited for her to share her expertise with you all today. So here's Meg.
Right. Thanks, Sarah. Hi, everybody. I'm Meg. I'm super excited to do this presentation. It's near and dear to my heart, so I hope you guys really enjoy it, and I hope you really take home a few points from this today. So just a little bit about burnout. My slides aren't moving. No, slides move. Here we go. So Christina Maslach was the original person that came up with the definition for burnout. It's depersonalization, inefficacy, and emotional exhaustion. And I can tell you, multiple times when I can think back to when I was completely burned out. So depersonalization, when the nurses would call me about patients, and they would say, the patient's in pain, and I was like, pain never killed anybody. So that's a total depersonalization of the patient, but that's just where I was at, and I was so overwhelmed with all the tests that I had to do. I needed to categorize that differently to get through the day. In efficacy, I can't tell you how many times I would get that page that was a really simple thing to do, like put in a diet order for a patient. And I just couldn't get it done. There'd be, a person coding, or there'd be, a chest tube that was leaking, and I just couldn't get to that page, and you'd get paged again 30 minutes later, like, where's the diet order? I just felt like I really was being completely inefficacious I just was not being effective at my job. And then emotional exhaustion, being completely overwhelmed. I remember so when you have a post-op CT surgery patient, they're just really long post-op appointments. You have to look at their blood pressure, put them back on their meds, are they in AFib? You have to look at their chest x-ray and their EKG. There's just a lot to them. And I remember one of my worst days, I remember going in and just checking the boxes. And I remember thinking when I was going into the patient's room, I just thought, I don't have anything to give this patient. Like I had no empathy to give. I had nothing else to give. I just kind of went in there, looked at the vitals, looked at the incision, and just kind of checked the boxes and sent them on their way. And that just wasn't the way I wanted to practice medicine. And that's not why I went back to school to be a PA. So that was just a little bit about burnout. And so as I realized I was really burnt out, I changed things pretty significantly. And then after changing that, I ended up going to the wellness ambassador training here at Duke. And Brian Sexton, who's one of the patient safety directors, helps put this on. And this was one of his slides that he put up. And this was the slide that kind of brought everything together for me. And I had known that I was burned out, but I didn't understand what burnout had touched in my life. And so I put this slide up here, and I'm just going to kind of walk through it with you, but it really was like a checklist for me. And I never had put it together before I saw this slide. So when they talk about lower quality of relationships and mental satisfaction, so I really had terrible relationships. And my husband literally would tell me, I just stay out of your way. And when I would walk in a room, he would walk out 9 times out of 10. My kids, when I would talk to them, shuddered. They would kind of, do one of these because they just immediately thought I was going to yell. I mean, that's the point at where I was when I was walking in the door from work. I didn't have any friends. I didn't really want friends. I didn't feel like I had the time for them. And whenever I had to do something socially, it was really trying for me. I, would go to a party and people would ask questions, and inevitably, the question comes up, what do you do? And I would tell them what I did. And then, I had one question where somebody asked me, well, why aren't you drinking tonight? And I said, well, I'm on call. And they said, well, what's call? And I said, if there's an emergency in the middle of the night, I might have to go in for surgery. And the person asked me, well, why would anybody have surgery in the middle of the night? And they just kind of laughed. And I was like, because they're dying, because it's an emergency. Like it was just a different world that they lived in. I really couldn't connect with people. So I really just didn't invest any time in friends. I was super exhausted, and I really didn't want to make the time. So first one, let's check that box. The shorter lifespan, I don't know about yet. I'm hoping that I have, you know, hopefully gotten to wellness, and I will not experience the shorter lifespan. So the depressed immune system, I didn't realize it at the time, but I'd had multiple things that I'd had doctor visits for, including weird rashes, and everybody was always kind of scratching their heads as I had these things. But the thing that really made me realize that my immune system was really poor was that I kept having a lot of heartburn, and I'd been on reflux medicine for years and years, and I just had to keep increasing it. So I went from, like, you know, PPIs once a day to PPIs twice a day. They added an H2 blocker. They treated me for H. pylori, even though I didn't have it, because nobody could figure out why I just kept having all this terrible heartburn. And finally, they did an EGD, and the doc, this is what he found. This is a picture of yeast in the esophagus. And it came out, and he asked me, he goes, "Do you have HIV?" And I said, "No." And he said, "Well, I've never seen an immunocompetent patient with yeast in their esophagus." And he goes, "And that's what you have. It's a very simple treatment, and we can take care of this." But he goes, I've never seen this in somebody that's healthy. And I think because I wasn't healthy, I was really had a depressed immune system.
Okay, do that, and then
the depression, PTSD, and suicide. I'm not sure about this.
okay, just
So somebody's got their microphone on. So
just interrupt. If anybody's on their phone, if you don't mind just muting, just so we don't get any feedback, that would be awesome. Thanks so much. Go for it, Meg.
So I think I had sorry. I worked in the ICU for many years, and there was a study that came out that said that nurses in the ICU, about 18% of them meet criteria for PTSD. And I was actually working nights, and it was really a tough time. And this movie came on that I watched, and the movie was Bradley Cooper. It's the American Sniper. I don't know if you guys have seen it, but basically he is with his wife in the car on the way to the mall, and he gets this moment of rage when she's talking about going to the mall and getting something, and he's had multiple trips overseas, and he's a sniper, and he gets just completely enraged with her, like kind of out of the blue, and she doesn't understand it, and he's going, "You have no idea what I have to go through so that you can go to the mall and just have these, you know, these freedoms that are not available, you know, worldwide." And I remember looking at him and in his rage, and I remember going, I've felt that way. And I'll tell you the story. So when I walk up to my school, I walk my kids to school, this is kind of what I see. This isn't an actual picture from the parents at my school, but this is kind of what I see. So I was on nights, and right before I left, I was giving report, and I was almost out the door, but I was giving report to somebody that was new. And a lot of times, because I had CT surgery experience, they had put me with somebody new so that I could kind of teach as I was giving report. And we get this page that this patient is tacking away at 250 beats a minute. And I'm going, there is just no way that this patient is tacking away. And I was like, the monitor's got to be double counting, but I'm not going to leave this new person with this situation. So we go to the room, and on the way to the room, I'm thinking, okay, we got ACLS protocol. I'm running it down with this kind of newbie. And we get to the room, and lo and behold, the monitor's not double counting. This patient is tacking away about 250. Blood pressure's dropping, but they're still awake and alert and oriented. And the only reason that they can tolerate this is because the guy was like 20 something. And it was just amazing to me, because I'm thinking, oh my gosh, I'm gonna have to shock this guy. And we're putting the pads on him, and he's looking at me like, do not shock me. And I'm going, I might have to shock you. And so instead of shocking him, I poured in IV fluids. I got the nurses lined up with IV meds, and we were pushing him and pouring in fluids. We never lost him, and I got his rhythm to break. And what I mean break, I mean I got it down to 150 and got like some good blood pressure. I mean, it was a win. We never lost him. We never had to shock him. And I felt great. I felt so good about it. I was like, this is great. I avoided shocking a guy awake. I got his rhythm down. We never lost him. It was so good. And I get out of the room and I look at my phone, and my husband has called me 3 times because it is now after 7 a.m. and he's supposed to leave for work at 7 a.m. And so it was just really tough because you come out of this room, you feel like you've done something good. You feel like you've saved somebody's life. And now I'm calling my husband and he's pissed, and he understands that there's emergencies, but he's pissed. And so, and I'm not even ready to leave yet. I still have to know in the chart about this. I still have to, you know, there's like things I have to do. So I try to get all that done. I run home, he leaves, he's upset, and I still got to get the kids to school. And I walk up to the school with my kids and my dog, and this is what I see. And there's all these moms, and they're in this little circle, and they're talking about stuff that is totally normal, but stuff that it's not my world. So my dog wants to walk up to their dogs. And so I come up, and these moms are talking about, I think it was something about spinning class, and they were all a Twitter about it, like, oh, blah, 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 and they were mad about something. And I remember getting to be like Bradley Cooper, and I was seething mad. I was so mad. I wanted to hurt these women, like physically assault these women, and they've done nothing wrong. It's just that I didn't have anywhere to put that anger of like, you have no idea what I have to go through so that you have care in the middle of the night if you ever need it. And nobody understands that except the people in medicine, right? Like, we go through these, like, we're on call on holidays. We work through the night. We do this because people need it. And when you try to assimilate back into, like, basically I'd gone from like saving a patient's life up to walking, you know, up the dog up to the school. It doesn't happen that quick. You can't decompress that quickly. And I felt like I was Bradley Cooper, like, and I will never forget this feeling because I never want to feel it again. I had to walk away from these moms. I literally just walked away. I didn't say anything because I was like, I'm going to physically hurt somebody if I don't just walk away. And that was really, really tough. And then you go home and you can't sleep because you're upset, and, you know, you have to sleep because the next night, I mean, it just goes on and on. So it was just a really, really tough experience that I didn't really put all this together until this slide. When you talk about traffic violations and accidents, I've never had an accident in my life except for this during this time period. And I was paying attention. I mean, it wasn't bad, but I was totally paying attention. I wasn't answering a page or doing the 17 other things I usually do when I'm driving, and I still hit this car. When you talk about personal injury, again, I was paying attention and I fell down the stairs. I totally hurt my foot. And the greatest part about this whole thing is I didn't miss a day of work. I was at work every day with 3+ pitting edema in my foot, but I didn't miss a day of work because I felt like I couldn't. And so, you know, it was really tough. On top of all this, at the same time, we decided to rip out our kitchen. We had been saving for 2 years, and it was time. We were just going to rip it out. And it was just amazing. And I remember calling my husband when I got in the car accident, and I was like, I can't believe I just got in a car accident. He goes, honey, we got the kitchen, you got work. You know, I mean, he understood that this was all kind of fitting into the mix. After the kitchen, when you think you have absolutely no more money, we found out that the toilets on every toilet in our house was completely rotted underneath, and so was our shower. So all of a sudden, not only did we have the stress of getting things fixed in the house, but we had the stress of, oh my God, now where do we find the money to do this? Because we're totally drained now after the kitchen. So multiple stressors. And then my 3rd grader, you can see how awesome this child is. She is amazing, but she was failing 3rd grade. And this was kind of the straw that broke the camel's back for me, because I knew she needed help, and I knew I was going to have to get her to doctor's appointments and to possibly tutoring and to whatever else she needed. And I didn't think I could. I didn't think I was able to do it with work. I wasn't sure how I was going to get it all done. And that's really what kind of broke me. And it's still really hard to talk about. So what did I do? So I think the hardest part about all of this was that for a long time, I was really super ashamed to admit I couldn't get it all done. And it's really hard owning up to that. Because I think in medicine, we do it all, and we do it better than anybody else. We go the extra mile. We do every task. We get everything done. And we're proud of that. But I couldn't get everything done, and I was failing, and that was really hard for me to come to terms with. And so I didn't really know what to do. So what do you do when you don't know what to do? You scroll Facebook. And so these are actual screenshots that I was taking during this time. And I still get a giggle out of them, but I mean, when you think about what I was screenshotting, it is pretty bad. I can't decide if I need a hug, an extra large coffee, 6 shots of vodka, or 2 weeks of sleep. If you eat well and sleep and exercise, you're gonna die anyway. Today is the kind of day where I wish vodka came out of my shower. Now, I tell you what, I was having a lot of trouble getting out of bed in the morning going to work, but if vodka had been coming out of my shower, I would not have had trouble getting out of the shower. For those of you that are wine drinkers, I don't discriminate. If you combine wine and dinner, the new word is winter. So, these are my screenshots on my phone. This is what was giving me some release. The other thing that helped me was I would blare music on my way home. And this was one of the songs that I would just like literally scream in the car because I have no voice. Some of these lyrics just really resonated with me. And it just says, I can stay awake for days. I can be a good machine. I can hold the weight of worlds if that's what you need. But I'm only human, and I bleed when I fall down, and I crash and I break down. And really what we need to recognize in medicine is that we're human. We are all human, and we all function at a very superhuman level every single day. And we cannot keep that up. We need to eat, we need to pee, we need to sleep, and we need to have emotions and be able to be vulnerable at work. We deal with very sick patients that die and that code and that have families that, cry in front of us. And that will always pull at another human's heartstrings, and we are human. And I really think that the culture of medicine needs to recognize that we need to be a little bit more human at work. So how do we do this? So this is where I'm going to go into a little bit about of where I think we can go to be a little bit, not only change the culture of medicine, but really be better for ourselves. So my husband, this is my husband. I love him to death. He saw my presentation last night and he goes, "Is that a picture of me?" And I was like, "Yeah." And he's like, "How long has that been going on?" And I was like, "For months." So anyway, it just cracks me up. But this is a picture, and he had a quote, and it really struck me one day. He has always said, "I'm just a big dumb animal." And he's the sweetest, most kind, loving man. But he's right. Like, our brains have not developed very much since we've been cavemen, and we're all just kind of these big dumb animals. And what I mean by that is our brains have been set on a path. So we've got 2 systems. We've got fight or flight, and then we've got system 2. And system 2 is where I want to focus, because we all know about fight or flight, but fight or flight does not last very long. So when we get a stress, like if a patient's coding or a patient's going downhill, we get this like immediate adrenaline rush. But then what happens is, when a saber-toothed tiger was chasing you and you got into the cave and you were safe, you came down from it. Well, what happens when a patient codes, there's no coming down from it. It's like all of a sudden, they're transferred to the, ICU, and then maybe you're on the ICU care, and then you're starting drips, and you're continuously worrying about this patient. So system 2 is what kicks in and keeps us with a high stress level and keeps us with increased cortisol. And so increased cortisol has been shown in high amounts to shrink your hippocampus. It contributes to memory and learning difficulties. It contributes to sleep problems. It also contributes to health problems, including high blood pressure and diabetes, increased belly fat. And this is where I think a lot of us are functioning on a regular basis. We have very high cortisol levels. Our stress levels are very high, and we're never coming out of this cycle. And so how do we break this cycle? So our brains need to figure out how to make new pathways. So in medicine, we are trained to see the bad. We are trained to see what is going to hurt our patients, what is around the corner, what can we predict, what can we prevent. We are always looking for the bad to keep our patients healthy. And so that's the way our brains are trained. And luckily, there's this thing called neuroplasticity, where we can change the way our brains are networked with neurons. But in order to do that, we have to practice it. And so we're really good at practicing the negative. That is what we've been taught. That is ingrained in us. But we got to learn how to practice the positive. And the way we do that is through positive emotions. Okay, so joy, gratitude, serenity, interest, hope, pride, amusement, inspiration, awe, and love are considered the positive emotions. And these little suckers are super powerful. You could have told me this 2 years ago and I never would have believed you, but please believe me that these bad boys, if you get them in your brain a little tiny bit every day, it will change the way your brain is, it will rewire your brain. So positive emotions undo negativity. So this was a study where they took a bunch of people, this is so great. So they took a bunch of people and they brought them in and they said, okay, in about 5 minutes, we're gonna have you go lecture to your peers for about 5 minutes on a subject of your choice. And they were like, what? Like, this is not what we signed up for. I didn't know we were signing up to give a lecture. So everybody started panicking and they had these heart rate and blood pressure monitors on them. And so all these people were like, I don't know what to say. What am I gonna do? What am I gonna lecture on? You know, their blood pressure's going up, their heart rate's going up. And then they said, okay, right before you go out there, we're gonna show you this little video. And so they sat these people down and they showed them 4 different videos. So they either showed amusement to them, contentment, no emotion, or sadness. And what was great about this is that the people that were shown amusement and contentment, those were considered positive emotions. Their heart rate and blood pressure recovered much faster than what they considered what was the control, the no emotion. And then if they showed them the sadness video, they actually took longer to recover. So it's just very interesting. So if you can hit a positive emotion when you're feeling stressed, then your negativity will decrease. So what can you do? How can you physically bring these into your day? So I'm going to go over a few things. So we're going to talk about changing your thinking a little bit, which you can immediately integrate into your day. We're going to talk about engagement and 3 good things. So changing your thinking. So frame of reference. This is a picture of a movie star, but this movie star looks, I kid you not, exactly like my neighbor. And so this is why I put this picture here. So my neighbor is this wonderful woman and her husband is a physician. And we have talked again and again and again about her husband and what he's going through because I felt like I could shine some light on it for her. And she never understood why he is always striving for the next thing or always complaining that he doesn't have enough. She said, you know, we have a great house. We've got 3 great kids. We've got cars to drive. She goes, you know, we have an amazing life. I just don't understand why he can't recognize that. And one day it hit me. So she's been very forthwith with me with her childhood. And she grew up in Pennsylvania in a very, very poor rural town, grew up in a trailer. They did not have a car. And her mom oftentimes would bring men home. She did not necessarily have food all the time. It was a very, very difficult upbringing. And she said to me, she said, even when it was at its worst, she goes, I knew that I had it better than the people down the road that were living out of their car. And it hit me that she made a really terrible situation seem better. And she still does this to this day. And this was something that I really took to heart because this is something that I integrated into my life immediately. So when it felt like Groundhog Day every weekend for me. And by Sunday night, I was mad as a hen because my husband works weekends and I had the children all weekend, all of the grocery shopping, all of the laundry, all of the stuff. And by the 7th load of laundry, I wanted to throw laundry across the room because I was like, every dang weekend, here I am doing the laundry, putting it away. Nobody's thanking me. I'm everybody's maid, you know, all the things that run through your head. And by taking her little bit of wisdom, I was able to really put it in perspective. And now when I'm folding the 7th load of laundry, I can thank my lucky stars that my kids are not in the hospital and that I know that there's parents in the hospital that are looking at their kids in the hospital bed wishing that their kids were messing up 7 loads of laundry every week so that, you know, they were out playing and ripping up their clothes. So it really changed my perspective, and it's simple to use. I mean, when I am in traffic and then I go by the person that was in the car accident, like, it's not me that was in the car accident. I'm not going in an ambulance to the hospital, or I'm not dealing with a totaled car. It just calms me down and gives me a different perspective. You can use this in all sorts of situations, and it's really easy to do this in medicine, because when you feel like you are reaching your wit's end, you literally can be like, I am not the patient. Whatever my patient has, I don't have it. I mean, that is a really easy way to flip it. We can do this every day very easily when you're starting to reach the end of your rope. So I think this is a really good one that you can integrate pretty easily. The other thing is, this has really helped me. I'm gonna give you some things that have really helped me. Being able to say at the end of the day that I was enough, that I did enough, I got enough done. My list will never be done. And my guess is that your list will never be done also. But you're enough. And you did everything you could, and I bet you showed up the best that you could. And this has really helped me when I'm sitting there at night kind of ruminating over all the things I have to do, and I have to shut it down in order to get some sleep. I really say, okay, I did enough today, it's okay. And I've kept a thing by my bed that I can write my list down so that I can get them off my brain and go to bed. I've also used something that I call what's the next fire, where there's some things that can wait. And I used to put everything on the list and weight it equally, like I had to get it all done. But now I say, what's the next fire? And that gets moved to the top of the list. And then the end of the list is, you know, stuff that can wait a little bit. So that's really helped me, because, you know, I would try, like, as soon as the email from the teacher came, I'd be like, I got to go get this stuff tonight, you know, but I don't. I've got 2 weeks to get it. So I've really kind of worked on what's the next fire. And then I've really been using technology more to my benefit. I've been using the reminders on my phone, the reminders on my, in my email at work, and also in Epic, which is what we use here at Duke. So that's really helped me, because once I can get it off my brain and know that I have a reminder for it, I just feel just a little bit calmer. Done is better than perfect. I used this weekend when I was wrapping Christmas presents, because I was like, they're a mess, and I'm literally like folding and crunching paper and like taping these huge swaths of tape over it. But I was like, you know what? Done is better than perfect. I use this all the time, because you know what? I'm never going to get every last dog hair, and it's going to drive me nuts, but I vacuumed and it's done. Same thing with exercise. I used to think I would have to exercise hard for an hour, get really super sweaty. Now I just go for a walk. Like, I just try to integrate these things into my day. Done is better than perfect. At least I'm getting things done. This works with progress notes too. Like, I used to want to have all the perfect progress note, everything in the same font, everything looking beautiful. Everything does not need to be in the same font. People are still going to be able to read it as long as it gets the point across. Sometimes I don't even use full sentences. Like, it gets the point. If it gets the job done and it's communicated clearly, done is better than perfect. So that one's really helped me. The universe has my back. So this is one that I've adopted fairly recently, and has really helped me in situations. I remember I had a situation where I had a patient that was 2.5 hours from Duke, needed to come in, not only get ultrasounded, a drain placed, there was something else, there might have been like labs thrown in there, and then something else, and then they had to be at like some other appointment by like 3 p.m. and it was 8 a.m. and my surgeon was telling me to get this done. And I was like, how am I going to get this done? And I was like, you know what, the universe had my back. I was like, I said it to myself, I'm like, I'm just going to start the calls and see what I can do, and whatever I can get done, great, and whatever I can't get done, it's not on me. Like, I'm going to do the best I can. And somehow it all got done. It all fell into place, and it was amazing. And so I've been using this ever since, because I'm just like, if I feel like there's something that can help me along during the day that's got my back, it just helps me get through the day. So I've used this multiple times whenever I'm feeling like there's no way that this can get done. I just say the universe has my back, and I'm going to get done what I can get done, and I move on. And for whatever reason, things have really worked out. So keep that one in your back pocket. Engaging is huge for bringing in these positive emotions. I've really practiced this. I can definitely consider myself an introvert, and so I can definitely walk into a room, sit down on a computer, not talk to anybody, and be happy as a peach because I just want to get tasks done. And I've learned that in order to bring in some joy and hope and all these other things into my life, I have to engage the people around me. And it can be tough in medicine because a lot of people want to engage in negativity. And so what I've done is I literally have started asking people about their weekends, their home life, but I've asked it in a way where you're going to frame it as, what was great about your weekend? Like, what did you do that was awesome this weekend with your kids? So that they're just telling you kind of the positive stuff, which has been great. And, it kind of brings up the room instead of bringing down the room. Make sure that when you engage with people, you listen to them, not to respond, but just to listen to them. So it's really super important. And I can't tell you how many more connections I've made and how this has really brought some awesome feelings into my life that I just didn't know were out there. I didn't want any part of it before, and I'm so happy now that I do this on a regular basis, and it's taken practice for me, let me tell you. So 3 good things is the last thing I want to talk about, and this is kind of amazing. This is a little bit harder to me to integrate into your day because it takes a little bit of time, not much. But the research behind this is so powerful that I just can't see. I don't want to take it out of my talk. So 3 good things is where you write down 3 good things every night within 2 hours of going to bed. And the people that do this for 7 days, this is what it was studied, had increased happiness and decreased depression for 6 full months. So they wrote down 3 good things for 7 days, and that practice led to increased happiness and decreased depression over 6 months' time, which is it's better than antidepressants. So I have to tout this as, it really is an amazing thing if you can do it. It's been studied further here at Duke, and if you do it for longer than 7 days, 14 days gives you the maximum benefit of it. So if you can find the time to do this and can do it for 14 days, that's going to give you the maximum benefit from it. Any longer than that, there's no further benefit. So it really is a very small input of time for maximum impact. And really, this is all about rewiring your brain. So the steps are that you have to actually write it down. It has to be within 2 hours of bedtime. And, all in all, why I give these lectures and why I want to get this message out there is I want you guys to choose you. I think for many, many years, I chose my patients, I chose my family, I chose everybody but me. And it really caught up to me in a big bad way. And the very first thing that I did to make a shift was I started buying a shake that was good for me in the morning because I was always worried about what I was eating for breakfast going into the OR. And when I came out of the OR, I was just eating crap. And so when I made that shift in my brain, because it was kind of an expensive thing, when I said I was worth it and when I started doing it regularly every day, it really made me understand that I was worth it and that I was worth putting some time into me. And that's really what made the shift. And that's really what I want you guys to do. I really want you to make sure that you guys just choose you and choose things that are good for you. And I want everybody in the profession to stay in the profession and not leave because they're getting burned out. So that's the whole thing. I am always here for questions, and I have so many more tools. I have so much more that I can give, but this is only a short snippet of everything that I have. So I hope that you guys found this hopefully pretty powerful, and I hope that you guys really take some points home from it. Thank you for letting me speak.
Does anybody that's tuned in have any questions for Meg?
Meg, thank you so much for sharing and opening up. I think this was one of the best wellness lectures that I've ever heard, so thank you for that.
Thank you. That's very, very nice of you. Thank you.
I just want to encourage everyone who wasn't able to tune in. I know that everyone has different work hours. Meg has put her email here, and just please reach out to her. Mm-hmm. I think I found her talk so powerful because I've related to her on many, many levels, and everyone thinks it's not me, and Meg is proof that you can come out of this burnout and it's okay. The most resilient people become burned out. You notice she probably did not use that word in this presentation intentionally. So just please use her as a resource. I'm thrilled that she's here at Duke, and I think we all need to utilize her more. So Meg, thank you for sharing this with our group. And I think we'll wrap up if there are no additional questions or comments.
Thank you, Meg, so much. That was amazing. I've recorded it to share with our members later to watch again as a good reminder. So I hope everybody has great holidays, and thanks so much. This is a great community, and it's nice to support each other this way.
Thanks, guys, for having me.
Thanks, guys.